Hello, my name is Daniel Trujillo, and this is my patient care encounter reflection. So, the story or the experience that I want to talk about is related to a close family member, my mom, who she was checked into an emergency room just on the night before New Year's of 20 going into 2025, and start of that night, which I remember the most probably, or where the memory started, was I was at my girlfriend's house around like 10 p.m. because we were getting ready to go to my family's house where we celebrate New Year's every year, like we've done for like as long as I can remember. And I get a message from my sister who was with my mom getting ready at her house. She was telling me that she took my mom to the emergency room around like 10:20, and she said she felt like she was having like a heart attack or some anxiety attack, and she said her heart was beating really fast. She was really concerned. So obviously my sister took her to the emergency room, and I had got there probably around like 10:30, and the receptionist at the emergency room front desk said that they didn't want to have a lot of visitors just yet since she had just arrived, obviously. So they were administering like vitals and things like that. And so we waited in the emergency room front, like in the lobby area there, for probably I'd say about an hour. So it was just around like 11:15, I think, when they said we were finally good to go in, and she was just resting. And so we obviously went to visit her. I was with my girlfriend, so we both waited in the lobby, and we went in to see my mom, and she was resting on the bed. She was tired from what it looked like when I walked in, and she was just my sister was there in one of the chairs just waiting with her. And from what I remember, in terms of like health professionals involved, I know there was a lady who came in with like the computer, like a nurse came in with a computer, and came to check all her like her heart rate on the with the finger clips and things like that, and like other like IV. They administered IV on her, so she went to like check on the status of that to see when it was over. And so she kind of explained to me and my sister, since we're like fluent in English, she explained to us kind of what was going on, and then she did a pretty good job of translating as well to my mom, who, since the provider was a Hispanic lady as well, she was able to speak Spanish, and my mom's fluent in Spanish and not very good in English, so that was a really good thing to have. She did a good job of explaining what was going on. She talked about how it was probably just some kind of anxiety attack, but obviously, if you've never experienced like a heart attack, my mom wasn't familiar with what the symptoms of that would be. So she had an like a very high heart rate, and it was going up really dramatically. And she felt, obviously she might have assumed that might have been a heart attack, and that probably didn't help with the levels of anxiety she was experiencing. So the provider just said that, yeah, she probably just had a really stressful moment where her heart rate felt like made her feel like she was having some kind of heart attack, but that there was nothing to be worried about on the cardiovascular side of things. So there was no complications there. It was simply a matter of stress. But she also explained that my mom got like chest x-rays to make sure that nothing was like physically going on in the chest area as well. So that kind of provided both me, my sister, and my mom with a more sense of relief, since they did a good job of like explaining the visuals of that, and it was a really relieving thing to hear, obviously. And in terms of like if it would have been beneficial for other healthcare providers to have like joined in or helped, I don't think it was necessarily necessary, but I think that one lady did a good job of explaining. So I didn't really have any concerns that they didn't do a good job that night. Obviously, it was New Year's. A lot of those providers probably aren't there, but they still have like a staff that can translate and help anybody who's there like pretty quickly if they need it. Um, Reflecting on just like how the professionals work, they all seem to. It was a pretty steady process. We weren't necessarily waiting for hours on end, which I know is a concern for some people. So I really didn't have a bad experience with the entire healthcare, uh, on the healthcare side of things there. And I don't think my mom did either, since she seems to be doing a lot better now, thankfully. And there's been no readmittance or like other symptoms visible or symptoms that are like similar to what she experienced that night. So uh, just kind of reflecting on the whole experience, I mean, I think it was managed pretty well, and thankfully everyone's doing healthy and fine. So thank you.